Association of ovarian cancer with you. Since no particular causes of ovarian cancers have been discovered by doctors, they usually suggest and try to explain the basic and genetic causes of this disease. Most of the time age plays an important role in building a disease within us. Ovarian cancer is the same. According to ovarian cancer symptoms, age is a very important factor which leads to this cancer. Other genetic diseases might lead to ovarian cancer. These diseases include anemia, postmenopausal bleeding, rectal bleeding and many more. Women suffering from this cancer might also lose their appetite. This results in extraordinary weight loss and thus more diseases. Is the use of alcohol related? A lot of people have the misconception that drinking or consuming alcohol in any way may cause this cancer, but this is not at all true. There are a lot of women who suffer from a lot of diseases by consuming alcohol, but ovarian cancer isn't one of them. Medical science has proved the association of alcohol and ovarian cancer wrong. Are milk and vitamin D associated? A study had been going on in Sweden. This study was about the women who had ovarian cancer. The study revealed the fact that women who drank 1 or more glasses of milk were to have ovarian cancer, and on the contrary, the women who didn't consume milk at all or just in a very little quantity, had half the chances of getting ovarian cancers. Isn't that weird? Further researches showed that women who lived in hot climatic areas were less likely to have ovarian cancer. This might be because all the women in those cities are exposed to sunlight and they gain a lot of vitamin D, but all these studies are not yet considered facts of science. A study also showed that women consuming a large amount of fat in their diet were prone to ovarian cancer. Exposure to silica minerals was also considered a cause of ovarian cancer, but all these are assumptions and very controversial. Diagnosis. Although we know that ovarian cancer symptoms are not very visible in its early stages, yet there are diagnostics possible for the disease after you suspect that you have it. The diagnosis starts with the physical examination of the patient. This examination is mainly of the vagina of the woman, as that is the area where the cancer develops. Then the patient gets a blood test. After that, the patient must go through a transvaginal ultrasound. The doctors need to perform a surgery then, in order to check the vaginal fluids and also to examine the organ from the inside. This might be scary for patients, but this might just save their lives. Since pregnancy is the best way of avoiding ovarian cancer, the doctors check the patient if they do or not have the ability to reproduce. The blood count of the patient is checked in order to check the number of cells and the number of cancer cells inside the body. The location of the cancer cells is also checked. This enables the doctors to detect the spread of cancer. OVA1 is something doctors consider that can identify the various diseases in the ovary of the woman as well as cancer. Once the doctors are sure that the patient has ovarian cancer, they can easily start the treatment. The higher the age of the woman, the higher are the chances of her having ovarian cancer, if she hasn't reproduced yet. Thus it is always advisable to reproduce at a young age and avoid all sorts of diseases and cancers of the ovary.